If you're trying to address multiple skin concerns but don't know how to layer or cycle your skincare without overwhelming your skin, this video is for you. I'll break down how to create a skincare routine that really works. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California, and I'm here to help you understand your skin and find products that work for you. I want to give you the tools to take care of your skin and your hair and your nails better. So if that sounds good to you, make sure you're subscribed to the channel and give this video a thumbs up. Now, when it comes to layering skincare, it can feel very overwhelming. You know, if you just have a couple steps, no big deal, but as you start to add 3 or 4 or even 5 things into your routine, you can start to wonder, am I doing this right or am I optimizing this situation? But the reality is there are very few rules when it comes to skincare. Where there are hard and fast rules, I will definitely be going over those in this video, but you also have to understand that how you layer your skincare has to work for you. It has to feel good on your skin. You have to make sure it doesn't pill up and that it's actually giving you the results that you're seeking. I would say as a dermatologist, my #1 rule when it comes to picking out your skincare and layering your skincare is making sure that you are choosing the skincare products that you're using intentionally. And what I mean by that is you should be selecting skincare that is meant to target very specific concerns that you have. So if you're trying to deal with hyperpigmentation, we are picking things that focus on that. If we are dealing with acne, we are choosing things that focus on that. And sometimes you can't do it all in a single routine, but I'm gonna show you how to get pretty close to it. And that might feel like something really obvious to say, but it is not uncommon that I will have a patient in my office bring in their skincare and show me what they're using. And so many times people will say, and I have this product and I don't really know why I'm using it, but I do it at this step in my routine. You should understand what everything in your routine is doing for you and why you have it there. Now we're gonna hop right into how to layer your skincare, but at the end of the video, I'm gonna be answering some frequently asked questions about layering and about how to optimize your results, so make sure you stick around for those. When it comes to layering your skincare, the general rule of thumb is that we are moving from thinner, more watery products to thicker, more oily products. And the main reason for that is if you were to start your skincare routine with something quite thick or occlusive, there's a risk that anything thinner that you layer on top of it may not absorb as well into your skin. Out of the gate, you wanna make sure that whatever skincare you're applying, you are applying to clean skin, which means that the first step in most skincare routines is going to be to cleanse your skin. Now, I will say in the morning, you may not need to cleanse. A lot of times people wonder, well, are all the products that I put on at night going to block anything that I'm doing in the morning? Do I need to rinse my night products off? But the reality is, as you sleep, a lot of that is either absorbing or rubbing off on your pillow. So unless your skin feels really oily in the morning or you can see some residue on your skin, you don't really need to clean it. And some people will say, okay, I know I don't need to clean, but should I cleanse my skin? And I really think you shouldn't unless you really feel like you need to, because the more you cleanse your skin, the more stripping that can be and the more irritation you can cause to your skin. And we always want to be thinking about minimizing irritation and minimizing inflammation, especially because, and we'll talk about this later, some of the actives that we put into our skincare routine, things that are going to help our skin cells turn over or promote collagen production, can be irritating in and of themselves. So we don't want to be adding other steps to our skincare routine that could irritate. So in the morning, you could rinse with water, you could do a little gentle cleanse, and then in the evening, I typically recommend doing something called a double cleanse. A double cleanse is just doing 2 separate cleansing steps in the evening. This is particularly important if you wear makeup or you wear water-resistant sunscreen, because it just really helps you thoroughly cleanse your face, but still be gentle with it. You're typically starting with an oil or a balm type of cleanser that really helps break down makeup or thicker skincare products so they can easily be rinsed away. And then you're going in with a second lighter gel or water-based cleanser to just remove any additional residue that still remains. Once your skin is clean, we're ready to move on with the rest of our routine. A question that comes up a lot, like I get a DM about it probably every day, is, okay, I have prescription medications from my dermatologist, either for my acne or to treat my perioral dermatitis or to treat my rosacea. Where do I put my prescription medications within my skincare routine? And what I tell my patients is that I want your prescription medications applied directly on clean, dry skin. So they are the first leave-on product in your routine. And you might be saying, ooh, well, that doesn't really feel good because you told me to move from thinnest to thickest, and some of these prescription medications can be quite thick. And what I would tell you is that for most of my patients who need prescription medications to handle their inflammatory skin condition, we are paring back their routine a lot. I don't typically want my patients with acne or rosacea or perioral dermatitis going in with vitamin C serums and hydrating serums and 3 layers of moisturizer and then their sunscreen. And I'll talk about this a little bit more, but I really want people to have a very simplified routine if we are actively treating skin inflammation. That doesn't mean that they can't bring things into their routine down the line, but we want to first focus on getting their skin condition under control, and then you can add the fun stuff. The other reason for that is sometimes someone has something in their skincare routine that is actively breaking them out or flaring their perioral dermatitis. So I don't want them to be using medication and then also having something in their routine that could be provoking their condition in the first place. So if you're ever prescribed something from your dermatologist to be using on your face, I think it's a really fair question, and you should ask this if they don't bring it up on their own of, okay, where do I put this in my routine? And tell them what other things you're using. But let's say you're not doing prescription medications. What do you do after you cleanse your face? At that point, you would go in with a toner or an essence if you want something like that in your routine. These are usually really thin, clear, or milky products that are there to add an extra layer of hydration to the skin. They're definitely becoming more popular in the US. They've been popular in Korea and in other countries for a really long time, but some people will find that their skin does much better when they have lots of little layers of hydration rather than going in with just one thick moisturizer, for example. So I always encourage people to play around with these types of things if they don't feel like their current skincare routine is satisfying to them. The other reason I like a toner or an essence is because it can act as a little bit of a buffer. So for example, afterward, if you're going in with any actives like vitamin C or an acid, which we'll get to in a second, sometimes having that tiny layer of milky hydration or some type of barrier support can help you tolerate those things better. So you do your thin toner or your essence, and then we're moving on to serums. Serums tend to be a bit thicker, and although none of these things have formal definitions when it comes to skincare, I always think of serums as something that contains an active or something that contains ingredients that are telling your skin to do something better, whether it's brightening, whether it's hydration, whether it's collagen production, or some combination of all of that. This is often where an antioxidant would come into play, so a lot of people use vitamin C serums to help protect their skin from oxidative stress. This is where that would fall in that routine. I go in with my vitamin C in the morning, then I do a hydration serum to help plump my skin. And then after that, I go in with any treatment serums. So there's a variety of treatment serums that I cycle through, and we'll talk about cycling next, but I have one for hyperpigmentation, I have one to help with my redness, and that's where that falls in my routine. Now there are certain types of skincare products that you shouldn't use in the same routine together, and if you have questions about that or you're wondering if you're using things together that shouldn't be, I definitely recommend checking out my video on skincare layering no-nos. In the evening, after I've applied any of those treatment serums, that's where the retinoid comes in my routine. Aside from sunscreen, retinoids are considered the best anti-aging topical that you can have in your skincare routine because they help with things like hyperpigmentation, fine lines, dullness. They're fantastic, and they come in many different forms. You may have heard of them: retinol, retinaldehyde, adapalene, prescription tretinoin, and those can be applied to dry skin. So some people like to just wash their face, dry their skin, apply their retinoid directly onto their skin. But because I have these other layers of hydrating serums and other skin supporting serums, I feel very comfortable with applying my retinoid after I've put on those other serums. And I'm not worried about them decreasing the efficacy of my retinoid. So you cleansed, you have your toner or essence, you put on your layers of serums, you maybe apply your retinoid if it's in the evening, and then you would go in with your moisturizer. Now, sometimes a moisturizer isn't really necessary at this point because of all the other skincare steps. You kind of have already achieved the moisturizing effect. But for some people, especially if they don't have a lot of those treatment serums in their routine, a moisturizing step is a must. And you just want to be picking a moisturizer that feels good on your skin and helps keep your skin moisturized and comfortable throughout the day. Moisturizers can be such a personal decision. If you want recommendations for moisturizers, I have a lot of YouTube videos over here with my favorites. Now in the evening, that's going to be the end of your skincare routine. But in the morning, you always want to finish your skincare routine off with sunscreen. I've said this once, I've said it twice, I will say it again. Moisturizer does not go on top of sunscreen. I still have patients that come into my practice and go, okay, I put my sunscreen on, then I put my moisturizer on, then I do my makeup. No, 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 no. Your sunscreen is like the jacket of your skincare outfit. It goes on the outside always. And generally, you wanna make sure that all of the skincare that you have applied before your sunscreen is fairly dried down. Sunscreen works effectively because it not only contains special UV filters, but those filters have to set up on the skin and create a protective film. So if you apply your sunscreen when your skin is still really wet from your other products, it's really hard for it to form an effective protective film. So often I'll do a lot of my skincare and then maybe do my hair, brush my teeth, things like that, and then come back and finish off with my sunscreen. Before we move into talking about skincare cycling, I do wanna take a second to talk about exfoliating acids. These have become really popular, especially over the last 5 years or so, but I still feel like there's a lot of confusion out there about how to optimally use them. So when you are applying an exfoliating acid, it is usually to help brighten the skin and help remove dead skin cells. They also can be collagen stimulatory, but it's really key that when you're applying an acid, you're doing it on clean, dry skin. The reason for that is you really wanna make sure your acid has even penetration. I always think of it like when I'm applying a chemical peel to a patient in my clinic, which is essentially an exfoliating acid at a higher concentration than what you would use at home. I want to be applying it to clean, dry skin because we want to make sure nothing is blocking it from penetrating evenly and you're not getting any what we call hot spots where the acid wants to pool up and may cause additional irritation. So when we look at that skincare routine that I just went through, the place I would use your exfoliating acid is right after you cleanse, and it could even take the place of a toner or an essence step in that case. If you're using a really mild acid that's not particularly potent, that could be used in your routine several times a week, maybe even every day if your skin can tolerate it. But if you prefer to use a more potent acid, which is how I do it, I'm just doing that 1 to 2 times a week. And then once that acid dries down, I'm moving on with the rest of my skincare routine, but I'm being really mindful not to have other irritating steps in my skincare routine on that day. So on the day that I do my acid, I'm skipping my vitamin C, I'm not doing tretinoin in the evening, I'm really letting that be the intense thing that my skin is handling that day. Now, some people are going to be able to use an acid in the morning and use their tretinoin at night, or use their acid at night and use their retinoid at night, but not everyone can handle that, and I would work in baby steps. Like, start with less, you can always add more. And this kind of brings me to my next point, which is talking about skin cycling. The term skin cycling was coined by my dermatology colleague, Dr. Whitney Bowe, and I think it was really smart to do this. It's things dermatologists have been recommending for years, but it really helps you conceptualize it when you think of skin cycling, which is essentially you are going on a cycle with your skincare where you are not applying the same thing every single day in your routine. And specifically, the products we are thinking about cycling are ones that cause maybe irritation to our skin, things that help with skin cell turnover, like acids and retinoids. Now, it would be great if your skin could handle an exfoliating acid and a retinoid every single day, but that's just not gonna be the case for most people. So the benefit of cycling through your skincare, perhaps doing exfoliation one day, a retinoid the next day, and then maybe having a day or two to recover, is that your skin is able to build up a tolerance to these products and it's not getting overly irritated or inflamed. Because I always like to remind my patients, yes, we are putting on these actives to get our skin to look better, but if your skin is constantly in this state of being irritated, you're really not seeing the benefits of that product and your skin is never going to actually look good. How you cycle your skincare is going to be very personal to you and what your skin goals are and what your skin can actually handle. So for someone like me who's been using actives for a while, but tends to have slightly sensitive skin, and I do have rosacea, my skin cycling looks like this. Things that go in my routine every day are my hydration serum, my redness serum, and any pigmentation fighting products that I'm using. So for example, that would be like hydroquinone if you're using a prescription product, or something like azelaic acid or arbutin. I'm also using vitamin C every single day except the 1 day a week that I exfoliate. Some people can handle vitamin C and exfoliation on their same day. My skin cannot. If we're looking at a 7-day week, I exfoliate on day 1, I actually recover on day 2, and then I use a retinoid on days 3, 4, 5, 6, and 7. So I have 1 exfoliation day per week usually and 1 recovery day per week. Now, if I feel like my skin is looking particularly dull, I will change up my routine a little bit and add an extra day of exfoliation and take out 1 of my retinoid days. And again, that's just coming down to having intentional skincare and tweaking your routine to meet your skin where it's at. If you cycle your skincare and you found it to be really helpful, let us know what your routine is in the comments and also what products you're using and what your skin type is, because we all read the comments here and it's going to help someone else out there. Now let's get into some frequently asked questions that I get. One is, how long do I wait between applying my skincare products? And for me, it is about 30 to 60 seconds. That's the average. But really what I'm waiting for is that when I touch my skin, it doesn't feel wet anymore. It might still feel a little bit tacky, but again, I just want it to like dry down for a few seconds. You do not have to be waiting minutes between skincare steps. And again, my only exception to this is really when I'm applying my sunscreen. I wanna make sure my moisturizer has soaked in for a while before I go in with that. Another question I get is, should I patch test a product? So should I test my product out on my skin before I bring it into my routine? And I would say that's not always necessary, but if you're someone who has a lot of allergies or skin sensitivities, it can be a great thing to do. I actually don't recommend patch testing on your face. You always want to be patch testing in an area that's protected from the sun. So a really good spot for that is right in the crook of your elbow. And essentially you're gonna patch test the way you would apply that product. So if it's a serum or a moisturizer or a sunscreen, you wanna apply a thin layer of it the same way you would apply it to your face, and do it every single day for a week, because sometimes sensitivities or allergies can take a few days to manifest. And I want to be really clear, the intention of patch testing is to test for a skin allergy. Patch testing is not going to tell you if a product is going to break you out, for example. A lot of people also want to know if they should be using a product once or twice a day. Most products you're going to use once a day, especially if they're an active like a vitamin C serum or a retinoid. Things that I always recommend using twice a day are over-the-counter hyperpigmentation products, unless you get too much irritation from using them twice a day. Moisturizers, those are things, essences, anything that's not really irritating to the skin, twice a day is usually better. Now, if you're using a prescription hyperpigmentation product like hydroquinone, that's a once a day situation. And then the last thing people usually want to know or should know is, how long should I wait to see results from my products? And to understand this, you have to understand a little bit about skin physiology and how it works. The top layer of your skin is many cell layers thick, and you are constantly cycling through those cell layers. And it takes somewhere on average between 4 and 6 weeks for your cells to fully cycle through from the bottom to the top layer. The older you are, the more mature your skin is, the slower that process is generally going to be. And that's why, as your skin matures, we often introduce things like exfoliating acids and retinoids to encourage that cell turnover. For the vast majority of products, I want to see the skin turn over 3 times. So at a minimum, about 3 months to see those results. Now, that doesn't mean you can't see results faster than a few months, especially for things like exfoliants, where their main function is to increase cell cycle turnover and break up dead skin cells on the surface. You may put that on at night and have brighter, more beautiful skin the next morning. But when we're talking about things like acne, like hyperpigmentation, like improving the appearance of your pores, I want like a minimum of 2 to 3 months. And also remember, if you're incorporating things to improve the quality or the aging of your skin in the long run, like retinoids, results are not just going to plateau at 3 months. They may continue to get better for months or even years thereafter. All right, that's gonna be a wrap on layering skincare. If you have additional questions, make sure you put them in the comments. Also, if you have any tips on layering skincare or things that have really worked for you, definitely let us know. Don't forget to give this video a thumbs up and subscribe to the channel, and I'll see you next time.